Hi, my name is Rebecca Andrews, and
I'm Brooks Andrews.
So our girls, Emma and Abigail, were born at 32 weeks, and they were actually born in Virginia. But I'm originally from Durham and just love my hometown. So they were there for 32 weeks, and they stayed there for 6 weeks, came home the same day, and so we're excited to tell our story. When we went into the hospital, well, to the doctor, sorry, to our regular routine visits, my blood pressure was going up quite a bit, and the girls, they were checking them since they were twins with their measuring them, and so they noticed they weren't growing at the same speed and keeping an eye on them. So they, with my blood pressure going up, they decided to be put in the hospital for a few days to kind of monitor the babies and everything in the progress. So I was diagnosed with preeclampsia. And so we did an immediate emergency C-section, and that's how it all began. And it was quite a sudden thing that was out of our control, and so that's kind of how our NICU experience began.
From the time they were born, it was really, you know, bam, 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 bam.
We're parents.
Yeah.
Ah!
So I was fortunate enough to have a little bit of flexibility in my schedule up till the time that the girls were born, to be there and support during the process. But afterwards in the NICU, it was a little bit different. We weren't there at the same time a lot.
Mm-hmm. I went up during the day with my mom. I did have my mom with me quite a bit. And we go up and hear the rounds, the morning reports, and that was helpful because I have a little bit of a medical background, but not quite a bit. So it was good to be able to ask the doctors questions and the nurses when they were telling us the updates.
I'd come up in the mornings, not every day, but early mornings, and then I'd go to work. I'd come back after work for several hours. You know, it was surreal. It was like, wow, is this really happening? Am I really a father? You know, I would be able to take the girls and lay them on my chest for a period of time, and it was exciting and what have you. But I still don't think I let it all sink in. I'm an optimist by nature, and I knew that them being born early did create concern. It created this situation where, hey, everything might not be okay. I knew that the NICU in general was the best possible place for them to be, that if there were situations that arose, that they had the capabilities to take care of what needed to be taken care of.
Another one of the great resources was the Ronald McDonald Room. We had one in Virginia, and it was a great place. It was like a peaceful place to go. They had snacks, and that we had so many people just wanting to know how they were doing and how they could help us or support us, or they were thinking about us. So we were able to go online during when there wasn't a care time, and just go on and use the internet, eat a snack, and just kind of just relax.
They try and take care of the things that are secondary so that you can focus on what you need to focus on to make sure your kids come home.
Mm-hmm.
She's the question asker. She wants to know everything. I really didn't want to know everything. I wanted to just focus on them growing and them coming home as soon as possible.
I'm a detail person, so it was, you know, I was down to the, you know, how much should I pump or breastfeed and things like that. And that was one of the things I struggled with, was that first, the feeling of out of control, that my babies aren't coming home, just like you would see moms with their babies leaving to be discharged, and mine were still there. And we do this day by day by day. But the breastfeeding was, I wasn't able to actually breastfeed, and I tried a nipple shield, and I did seek out the nurse practitioner and the lactation specialist to be able to help me with that, and ask them lots and lots of questions. So But that was a feeling of out of control, and I did develop postpartum PTSD, and I did seek a counselor for that. And I do encourage anybody who's going through some things where you're feeling out of control and low points, sad points, where you just talking to someone helps. It did for me. They stayed there 6 weeks. They had their ups and downs. They had blood transfusions. They had let's see what else. Emma had some issues with infection, and we just trusted the doctors that what they were doing, they were taking care of them, and so they did. They were able to come home, not as soon as we wanted them to. We had some dates. We thought they were going to come home, and then they had a setback with the car seat test, and they both failed the car seat test. But you know, they did come home, and it actually was the same day. So
and we didn't have to bring home any
the car bed,
medical equipment or anything like that, and any CPAP or what have you.
So with our story, we didn't have to do that.
Because of the routine and the schedule that they were on in the NICU, we were able to incorporate that into our lifestyle at home. And because of all the ambient sound,
that was awesome.
They slept really well too. When
they were great sleepers. Still today, they're great sleepers.
In the NICU pods, there's a lot of just different noises, different beeps and the
blood pressure, the heart rate.
Yeah, there's
oxygen.
A lot of stuff, a lot of different noises. But when you put them all together, they kind of, I don't want to say were soothing, but they were just.
They were used to noise all around them all the time, just people talking.
Yeah.
They fed every 3 hours, and so it kind of helped us. We knew what a schedule would be that worked for them, and they kind of trained them. So it was kind of a perk. But
we'd wake up at nights to feed them, and we would.
Yeah, we tag teamed.
We would try to. Well, one baby ate faster than the other, so
we'd fight
whoever woke up first got to take her.
Yeah. After the NICU, we did have to boost their calories some because they were still little, and I was able to reach out to the nutritionist because she was able to help me with the calculations, with the math and stuff like that, to boost the calories in the formula to make it just right. And then I took a Pampered Chef bottle, and or it was a mixer thing, and you could use any type of mixer, but just to mix the formula and set the bottles out for 24 hours. So we were ready to go, and that just worked for me because I'm a planner, and it just eased my mind and reduced the anxiety for me. So I could, we can just grab the bottles, put them in the warmer, and we were ready to go, ready to feed. So, but that was a big, speaking of the lactation specialist and the nutritionists, those were resources we reached out to, and there were social workers that were great with financial questions, to if there was anything, funding or whatever that we could reach out to or apply for to help us with additional, since we had ×2 babies, and so that was something we were encouraged to do, was just reaching out to our different resources. So everyone was a big help, and if we didn't, I was the kind of person that if I had a question, I'd find out the answer to it some way through somehow. But yeah, you want to go first?
Control what you can control. Try not to worry about other people's jobs or other people, what they're trying to do for you. Control what you can control. Biggest thing is, it's a very emotional time. It's a very intense time, and the more you set yourself at ease, the more you focus on what you can do, the less stressful you'll be.
Internet wasn't a good resource because there's lots of things that aren't true, and so going to the right people, the doctors, the nurses, they can give you good sites that are approved, that are medically approved, to be able to reach out and find out the right resources you need. For a red flag for me was the feeling the low points, the feeling depressed, not wanting my children at one point, literally not wanting them. And so that was a time where those were red flags that people around me, Brooks and my mom, saw that, and they were like, you need to get some help. You really need to seek a counselor. So we actually went together some. I went by myself, but to get the help I needed to reduce the anxiety and just help that. But getting if you have red flags, or just seeking the support you need. So
I don't know if we ever mentioned Abigail was 2 pounds 7 ounces. Emma was 3 pounds 11 ounces. They, they fit in the palm of our hand when they were born, and to see them now, it's like, wow, you were really that small.
They would hear our sound, our voices coming in, and their monitors would start going off. There were things still to this day, like we would sing them certain songs, and they still request those certain songs. It's
one of the things we still enjoy doing is rocking them. There was a rocking chair in the NICU, and being able to hold them. They're almost 5, and they still enjoy that before bedtime.
Yeah.
And it's familiar for them. They look forward to it.
Something. I know there's some resources right now they have in the ICN at Duke with voice recordings and things you can leave, so that while you're not there, your baby is still hearing your voice, or a song, or just something familiar to them. And there were ups and downs when we got home, and the regular kind of sicknesses with viruses and things like that. But one thing I haven't mentioned is we also reached out to our pediatrician, because those were our trusted resources that could tell us about preemie babies, and how to just, if it was something serious to think about. And he gave me kind of a list, our pediatrician, so not to freak out so much. That was my personality, like, oh no, I need to take him to the doctor right now. But just kind of look at the signs of what's normal, what's not. And there was always a 411 call, to the nurse on call or something like that, the doctor on call. So how do we overcome everything that we went through as a family? It took time, time, and taking every day as it came, planning for what we could. My personality is different than Brooks's. So I was a planner. I mentioned the milk, setting the milk out for me, so and getting that ready. And for Brooks, he was a good listening ear. He kind of did whatever I asked him to do, or just like,
So I played my part. I did what she asked. I helped in any way that I could. Emotionally, I think I disconnected myself from the whole NICU. I didn't emotionally get involved, and I don't know if that's a good or bad thing.
It was.
I accepted the fact that if anything were to go wrong, they were in the best possible place, and that's kind of how I just left it.
So I will say the ICN experience was a roller coaster ride. There were highs and lows every day. Since I went up in the mornings most of the time, I was there for the when the doctors would come around, and we'd hear good news. We'd hear, oh, Emma had she had the monitors go off several times.
Sometimes the doctors, part of their job is to tell you worst case scenario or what could be.
Very true. Yeah.
And you just have to accept all that with a grain of salt. And understand that while it might be worst case scenario, it's not always what the fruition would be, what would happen.
Life might not be perfect, and with kids, they're resilient. Kids are very resilient, so just trust that they're at the right place at the right time for their first part of life, and just enjoy the ride.